Hi, myself Dr. Deepak Kumar Maharana, Consultant Vascular and Endovascular Surgeon, Lotus Hospital, Lakdi, Hyderabad. Today I am going to speak something about the diabetic foot.
What is diabetic foot?
A diabetic foot is any pathology that results directly from the peripheral artery disease and or sensory neuropathy affecting the foot in diabetes mellitus. It is a long-term complication of diabetes mellitus due to restricted blood flow in the limbs with unnoticed cuts and infection that results in the numbness area of the feet.
How does it occur?
Diabetic foot occurs in number of mainly three mechanisms. Mostly, first is the diabetic angiopathy, next the diabetic neuropathy, and thirdly is the glucose tissue is a good culture media for the bacteria to grow. And in case of diabetes mellitus, that of long duration, the diabetic because of diabetic neuropathy, the patient develops reduced sensation of the pain in the legs, and with minor injuries that goes unnoticed for a long period of time. And that develops infection sets in, may develop into full thickness diabetic foot ulcer, overwhelmed by the poor blood circulation.
What are the signs of diabetic foot?
There are number of signs of diabetic foot. Mostly there is change in skin color, change in skin temperature, there will be swelling of the limbs, there may be pain in the limbs, there may be open sore that takes long time to heal or it may draining, there may be formation of corns and calyx, there may be ingrowing two nails or two nails infected with the fungal infection, and there may be dry crackles in the skin, mostly around the heels.
What are the serious complications?
There are a number of serious complications of diabetic foot that are managed improperly, mostly because the diabetic wounds takes a long time to heal, and if infection sets in and that's spreading to the bones and joints, causing abscess, gangrene and deformities, and ultimately may lead to the toes and limb amputation.
Is diabetic foot curable?
If properly managed, diabetic foot is curable, but most patients needlessly go for amputation because of improper diagnostic and therapeutic approaches.
How to prevent diabetic foot?
Diabetic foot can be prevented by a number of ways. Firstly, the most important, to optimize metabolic control of the blood sugar by strict blood sugar control by oral diabetic diet, oral diabetic medications, and the insulin therapy. Secondly, in identification and screening of the people at high risk for the diabetic foot ulcer, especially those with the severe degree of neuropathy. And third is most important is the patient education regarding the self foot care examination and diabetic foot care in lesions such as hyperkeratosis and fungal infections, skin lesions and deformities. And next is the proper use of the diabetic footwear. The footwear should not be too tight because it may cause repeated trauma to the foot, and also the increased temperature. And last and most not the least is the stoppage of smoking and alcohol.
What is the treatment of diabetic foot?
For the treatment, diabetic first and most important is go for the proper investigation, such as you can go for CT peripheral angiography to diagnose whether there is critical lesion, critical blockage or critical stenosis of the limb arteries. If there is limb artery stenosis there, you may go for balloon angioplasty or stent placement. And regarding the surgical point of view, you go for daily dressing, debridement of the gangrenous parts, and if possible, there is the need for skin flap or skin surgery or skin grafting. And first and next is the most important is go for the culture sensitive wound pus and start the proper system of antibiotics. Thank you.
Lotus Hospitals is one of the leading brands for all your health needs. You can visit our expert doctors at any of the centers, Lakdi, Kukatpally, Nagar and Vizag. For booking an appointment, you can use our app or visit www.lotushospitals.in or call on 040 4040 4444.